Hey everybody, my name is Cody Strait, and in this video, we're going to talk about the 6 common challenges that hospitals face when approaching an electronic signature project. So let's get to it. All right, guys, so for 20 years plus, we here at Access eForms have been helping hospitals convert their paper-based processes into EHR integrated electronic processes. And this means that we've really got a lot of experience whenever it comes to closing the paper gaps associated with consent forms. EHRs are wonderful, whether you have MEDITECH, Epic, Cerner, they are really wonderful systems focused on clinical documentation. But whenever you deal with certain form processes, namely consents or government forms, those manifest as paper gaps that persist in your hospital. So we've been providing eSignature to hospitals, of course, to help close those gaps. But as we have worked with different hospitals approaching an eSignature project, we have seen them face a lot of challenges. And so there are 6 challenges that are very specific that we want to cover here in this video so that you can be aware of them, learn from them. So as you approach an eSignature project, that you can ensure that you have a successful, smooth rollout of eSignature, that you avoid failure. Now, also, I will say this, that these different challenges that we're going to be covering here, they are agnostic to any specific EHR. They are also agnostic to any specific eSignature supplier, such as ourselves. So regardless of who you choose, whether you're Epic, Cerner, MEDITECH, or so on and so forth, these challenges will certainly resonate with you and you need to have a look at them. So let's get into this. Okay, so eSignature challenge number 1. This is the first thing that you really need to be mindful of whenever you're looking to have eSignature for your hospital. So there's a lot of eSignature providers out there. There's great solutions that work in the finance industry and the hospitality industry. We interact with those all the time, also just at the consumer level. But the question is, of course, if I can use eSignature whenever I engage in those processes, can we apply that same technology to our hospital landscape? And simply put, the answer is sometimes, okay? Depending upon which solution that you look at. But here's the very first thing that you need to think about and consider as you approach an eSignature project if you want it to be really successful, is that as your clinicians have really become more and more accustomed to the EHR that you have in-house, again, MEDITECH, Cerner, Epic, whatever that is EHR is where they live. That's their home base. So what we've experienced is that anytime that you ask those clinicians or hospitalists or whomever to engage with some sort of a solution that lives or exists outside of that EHR experience, that's going to be a really big ask. And this is all about user adoption, okay? So if you can take an eSignature solution, and not unlike any other solutions where you're concerned about user adoption, if you can put that inside of the EHR user experience somehow or another, perhaps in the user interface, then you know what? You're in a really, really good way. But if you can't put that eSignature solution inside of that EHR experience, it's going to be in the periphery of those users, which means they are less likely to actually use it, which means you are going to have an uphill climb to get those users to adopt that eSignature solution. So you really need to, first and foremost, consider whatever eSignature solution you're looking at, can it integrate into my EHR so that way it provides a more seamless user experience? If the answer is no, you got a big uphill to climb. Okay, so challenge number 2 is that hospitals all too often approach eSignature with just the needs of a single department in mind. And most hospitals start by applying eSignature, rightly so, in the patient access or registration area. And there's a lot of reasons for that. That's where all your patients come through. That's where there's tons of paper that's generated as a result of that. So you can get really big bang for your buck by applying eSignature and reg. And again, that's great. So definitely start there. But if you are only looking to the needs of registration or patient access, then and you myopically apply that to your selection of an eSignature provider, that will be wonderful for reg and patient access. However, patients sign documents elsewhere in your hospital. So you need to consider, what are the eSignature needs for other departments like radiology, surgical services, oncology, labor and delivery, anesthesia, right? All these other areas, patients sign documents, very important documents for that matter. So whenever you're looking at eSignature solution, you really need to think about not only how this can serve the department that I have in mind today, but how can this also serve the needs of the other various departments as well. Yes, it takes a bit more time to consider that, but trust me, it will be absolutely worth it if you can have a single eSignature solution that you can use to tackle all of your needs for eSignature across your hospital's enterprise. Okay, so challenge number 3 here deals with the differences between the application of eSignature in registration and at the bedside. So really it's kind of a continuation of challenge number 2 here, and that what you really need to understand is that registration is very, very different than capturing patient's electronic signature at the bedside. What a lot of hospitals use in registration is they'll use something like this, because the patient is sitting opposite of that registration clerk at a desk. So this will be sitting on that desk and the patient can interact with it and sign it. Okay, so it's really great as far as using this for registration, but there's a little USB cord that comes out here, and this device from Wacom, which actually is a beefier size, there's a lot of other devices from Topaz. If you're handing this to the patient, this is kind of a tough thing to get a grip on. And again, this has to be tethered to a workstation. So you have to wheel over a workstation next to the patient bedside. That can produce some pretty significant logistical challenges. So while this might work in the registration area, it's not likely to really be a great solution at the bedside. So tablets, mobility is a better type of a platform in using eSignature at the bedside. Okay, so you really have to consider tablets. And then it's also a matter of forms. So the forms that you're using in registration are often really simple and straightforward. You've got your general consent for admissions, you've got your financial agreement, your general HIPAA acknowledgement policy, right, if you're a hospital here in the stateside. So those are just look at them, read them, sign them. But in the clinical care setting, you've got forms that are a lot more complicated, which brings us into a challenge we'll get at here, challenge number 5. Okay, before we though get to challenge number 5, I want to talk about challenge number 4, which is a bad paper form will make for a bad digital form, okay? So look, we see it all the time and it's understandable. You're really excited about this new piece of technology. You're really excited about what it can do for you. So in the aspect of eSignature, you're excited about, hey, all this paper I can save, all this money I can save, I can improve the patient experience, and that's really great. And that's worthy to get excited about. However, you need to look at the paper processes that you're wanting to convert to a digital process, because it is not uncommon where hospitals actually look at those paper processes and as they're trying to digitize them say, wait a second, this form is not fit for purpose today. Maybe it was good in 1994, but it doesn't fit our needs today. And so what happens is this project, this eSignature project, as it's moving forward, once it hits these kind of roadblocks that, hey, these forms really aren't appropriate today, they have to go and get analyzed and get reviewed. And because of the nature of the forms, oftentimes they're legal, you have to get legal involved, you got forms committee, you got department heads. It really can slow down the momentum of your project. So while you are considering an eSignature solution, take a moment and look at the forms that you're actually wanting to digitize and ask the qualifying questions to the people that use them. Why do you do this certain thing? Why does this exist on this form? And is this form still appropriate today? If it is, great. But if it isn't, you can go ahead and start that work today. And that way you don't have to slow down your implementation process for an eSignature project. All right, so problem number 5, not all forms are created equal. So going back to that registration example, forms are really simple there, but a couple of things that you really need to consider whenever you're evaluating an eSignature solution provider is looking at informed consents and looking at things like POLST forms, or otherwise known as MOLST forms. So when it comes to informed consents, yes, you need to capture signature there, and yes, you need to capture the signature oftentimes of the surgeon, but there's more involved with that form. So for an informed consent, you're gonna have the name of the procedure, the description of the procedure, the associated risks, and possibly other data elements associated with that procedure. So your eSignature solution provider should be able to accommodate all of those if you actually want to have a successful go at using an eSignature solution to convert paper processes associated with things like informed consents to an EHR integrated process. So again, you really want to evaluate those things and ask the vendor, how is it you can help me collect data, bring in data, leverage a third-party data management platform like an Elsevier or something like that to bring content over into that form, and can that still be editable? So there's a lot to ask around the world of informed consent, but that is a tremendous area to apply eSignature, but if it's done wrong, it's very hairy. All right, and finally, the challenge now that we're seeing a lot of is taking the eSignature solution set that's used inside of a hospital and extending that outside of the hospital. Now, what's the application and why would you do that? Well, this is largely as a result of the pandemic because look, telehealth, of course, has really grown at a tremendous rate, and that's because you're trying to meet the patients where they are. This is just a continuation of that. Now, oftentimes these patients are going to have to come into your hospital, and what you don't want is you don't want a clogged up waiting room, okay? And because obviously that's one of the main reasons or opportunities for COVID to transmit from patient to patient and also patient to staff. So the fewer people you can put inside of your waiting room and also the less time that they can spend in your waiting room is the goal. So by extending an eSignature form, or a form that you can use eSignature to capture patients' signatures outside of your hospital is a really ideal way to aid that because the patients can electronically sign all of their documents before they come into your hospital. So that way there's fewer patients inside of your waiting room. And whenever these patients do come in, you have a contactless check-in process that is much, much faster. So you get the patients in, they don't have to touch anything, and then they get on their way as to where they need to go. So again, you're gonna see a lot more of hospitals needing to take their eSignature solution that works in-house and extending that to the patients at home. All right, so there you have it, guys. There are 6 challenges that you really need to have an eye towards as you look to apply eSignature for your hospitals. And again, hey, we've been providing eSignature to hospitals for over 20 years. We are experts in this. So if we can help in any way, it's not just a matter of selling you our solutions or doing demos or all that sort of stuff, right? If you just have questions and you're wondering, how can I create a business case? What questions should I ask my vendors? All of those kind of things. We are happy to help you with any of that. It is truly our pleasure because we want to help you achieve your goals in providing better care to the communities that you serve. It is our privilege to be able to be in that position to help you in that regard. So thank you so very much for taking a moment to watch this video and engage with all of us in this. So if you have questions, if you have comments, drop those down below. We will personally respond to each and every single one of those. But for now, thank you so much and happy paperless hunting. Take care.